Liposuction, T journey of beauty and what you need to know. Hello everyone, welcome back to my channel. Today we're diving into a super hot topic in the world of beauty. Liposuction. If you've ever wondered what liposuction is, how it came to be, or what risks you might face, you're in the right place. I'm going to break it all down in a way that's easy to understand, super relatable and packed with useful info. So grab a snack, get comfy, and let's explore the fascinating world of liposuction together. This is going to be a 7-minute journey full of insights, so let's get started. First off, what exactly is liposuction? Liposuction, or lipo as it's often called, is a cosmetic surgery that removes excess fat from specific areas of the body, like the belly, thighs, arms, or even under the chin, to sculpt a more defined shape. It's not a weight loss method but a way to target stubborn fat that won't budge, despite diet or exercise. Think of that pesky belly fat that just won't go away no matter how many crunches you do. That's where liposuction comes in. But liposuction has a long and interesting history, and it hasn't always been as safe as it is today. Let's take a trip back in time to see how it all began. Back in 1977, an Italian doctor named Dr. Fischer coined the term liposuction. At that time, the procedure was pretty risky. Doctors used what's called the dry or wet techniques, which often led to serious complications, including excessive bleeding and, sadly, even fatalities. It was a rough start for liposuction, and the lack of proper tools made it a dangerous game. But things started to change in 1978 when a French dermatologist, Dr. Iloaz, introduced the super wet technique. This method involved injecting a hypotonic solution with epinephrine, a drug that constricts blood vessels to reduce bleeding. This was a game-changer, making the procedure safer and less painful. The real breakthrough came in 1987 when Dr. Jeffrey Klein, a renowned American doctor, introduced the tumescent technique in the American Journal of Cosmetic Surgery. The word tumescent comes from Latin, meaning swollen or engorged. This technique involves injecting a large volume of a special solution into the fatty tissue before suctioning it out. This solution contains 3 key ingredients: epinephrine to minimize bleeding, lidocaine for local anesthetic, and sodium bicarbonate to reduce the stinging pain caused by lidocaine's acidity. The beauty of the tumescent technique is that it allows liposuction to be performed under local anesthetic, eliminating the need for risky general anesthetic. This drastically reduced bleeding, pain, and recovery time, making liposuction much safer and more accessible. Since then, technology has taken liposuction to the next level. In the early days, doctors used manual tools. But now we have advanced equipment like ultrasonic laser, which emulsifies fat with sound waves, and vibrating devices like Microair from the US and Lipomatic from Belgium, now called EVA. These tools make the process more precise and less invasive. In places like South Korea, a hub for cosmetic procedures, doctors combine lasers and ultrasound to enhance results. From a risky procedure in the 1970s to a highly sophisticated one today, liposuction has come a long way. Isn't that incredible? Now, let's get to the part everyone needs to hear. The risks. While liposuction is much safer today, it's still a surgical procedure, and no surgery is without risks. The complications of liposuction can be divided into 2 categories: aesthetic and non-aesthetic. Aesthetic complications affect the appearance, like uneven skin or noticeable scars, and often stem from the surgeon's skill level. Proper training can prevent these issues. Non-aesthetic complications, however, are more serious and require careful attention from both doctors and patients. Let's start with the common, less severe complications. One of the most frequent is seroma, a buildup of fluid under the skin, especially in the arms. It causes swelling, pain, and hardened skin, typically appearing 1-2 weeks after surgery. Doctors can treat it by draining the fluid with a syringe, guided by ultrasound to pinpoint the fluid's location. I've heard of cases where seromas resolved within a couple of weeks, with regular aspiration, so it's manageable if caught early. Another common issue is hematoma, or blood pooling under the skin. This often happens if the tumescent solution isn't properly infused, leading to bleeding into fatty layer. For example, one patient had a hematoma the size of a baby's fist after flank liposuction because the procedure was done too close to the muscle without enough tumescent solution. Luckily, with proper compression, it cleared up in 2 weeks. Another case involved a patient who ignored post-op advice and took a bath a day after surgery, causing a hematoma. So, following your doctor's instructions is super important. Scars are another common concern. Tiny incisions are made during liposuction, and while they are usually small, 2-3 mm, they can leave scars, especially in people prone to keloid scarring. Areas like the abdomen or thighs are more likely to scar than the arms, especially if the skin rubs against clotting. Most scars fade within 1-2 years, and treatments like plasma lasers or triamcinolone injections can help. To minimize scarring, surgeons should reduce cannula friction at the incision site. Pigmentation issues like hyperpigmentation also occur. Hyperpigmentation or dark spots often appears at incision sites due to post-inflammatory changes. These usually fade after a year or 2, but in rare cases, they persist. Hypopigmentation or loss of skin color is less common but can happen with laser-assisted liposuction if the laser damages melanin-producing cells. Treatments like hydroxyquinone or laser therapy can help, but prevention is key. Other minor complications include temporary bruising, numbness, nerve injury, allergic reactions to drugs, fainting, or superficial skin irregularities. These are usually short-lived and manageable with proper care. For example, fainting or lightheadedness can occur within 12-24 hours after surgery due to mild fluid overload or lidocaine effects, but resting and hydration usually resolve it. Now let's talk about the rare but serious complications. These are the ones you really need to be aware of. Pulmonary embolism and deep vein thrombosis are life-threatening conditions that can occur, especially under general anesthetic. However, studies show that using local anesthetic with the tumescent technique reduces the risk of pulmonary embolism to nearly 0. Abdominal organ injury is another rare but serious risk, preventable with proper techniques and safety-equipped cannulas that stop when they touch muscle. Excessive blood loss, severe infections, hypotherio, and lidocaine toxicity are also rare but dangerous. For instance, lidocaine toxicity can cause nausea, dizziness, confusion, or even seizures if the dosage exceeds safe limits, typically 35 mg/kg for tumescent liposuction. Using too much bicarbonate in tumescent solution can also spike lidocaine levels in blood, so precise measurements are critical. Infections are another concern, too rare with proper sterilization. For example, a patient developed cellulitis 2 weeks after arm liposuction with symptoms like swelling, pain, and fever. Intravenous antibiotics and ice packs resolved it within days, but it shows that infections can pop up even weeks later. To prevent infections, surgeons must sterilize equipment, use antibiotics, and avoid incisions near sensitive areas like the perineal region. Hypotherio is a less obvious but serious risk. Cold tumescent solution can lower body temperature, leading to complications like arrhythmia, bleeding, or delayed lidocaine metabolism. Using warm, 37 degrees C tumescent solution and heating equipment in the operating room can prevent TIS. Syncope or fainting is another issue, often caused by mild fluid overload or blood pressure changes after surgery. For example, removing compression garments too quickly can cause orthostatic hypotension, leading to dizziness. Resting and standing up slowly can prevent TIS. To wrap things up, liposuction is a powerful tool for body contouring, but it's not without risks. Choosing a skilled surgeon, following pre- and post-op instructions, and understanding your health conditions are crucial for safety. For instance, stop taking blood-thinning drugs like aspirin or ibuprofen a few days before surgery, and make sure your hemoglobin and thyroid levels are checked if you have underlying conditions. Liposuction isn't a magic bullet for weight loss. It's about sculpting your body. So do your research, choose a reputable clinic, and make informed decisions. Thank you so much for watching. If you found this video helpful, give it a thumbs up, share it with your friends, and hit that subscribe button for more nudity and health insights. Got questions about liposuction? Drop them in the comments below, and I'll do my best to answer. See you in the next video.